Hey guys! Today we are going to talk about gastro-oesophageal reflux disease or GORD. GORD is described as symptoms or complications resulting from the reflux of gastric contents into the esophagus or beyond, including the oral cavity or lung. It may occur with or without esophagitis, which is inflammation of the esophagus. The risk factors are a family history, hiatus hernia, obesity or pregnancy, as these can change the internal anatomy, asthma, smoking, dietary factors, even though evidence here is limited. Foods include citrus, chocolate and spicy foods. Also, NSAID intake can cause GORD. The main symptoms are heartburn, which is a burning sensation in the chest after meal, which can be worse when the patient is lying down or bending over, or acid regurgitation, which is when acid refluxes into the mouth, leaving a sour or bitter taste. Other symptoms include dental erosion and a cough or a hoarse voice due to the acid going towards the lungs. If the doctor suspects GORD, they will put patients on a course of PPI inhibitors to see if they will relieve the symptoms. These are drugs that inhibit acid secretion in the stomach. If these drugs work, the patient most likely has GORD. If the patient has signs of a more complicated form of GORD, which we will talk about later, they will be given an esophageal gastro-duodenoscopy or an esophageal capsule endoscopy. This allows the doctor to look inside to spot any signs of these complications. If these signs are present, the GORD is called erosive reflux disease or ERD. A barium swallow can be used when endoscopy is not available. Esophageal manometry allows a doctor to assess esophageal contractions and lower esophageal sphincter function, which we will also talk about later. So, how does GORD actually happen? The lower esophageal sphincter regulates food passage from the esophagus to the stomach. Episodes of transient lower esophageal sphincter relaxation are normal, and these can be triggered by high-fat meals, but they occur more frequently with GORD, causing reflux of gastric content into the esophagus. If the person is diagnosed with GORD, they are given PPIs as a first-line treatment along with lifestyle management. Lifestyle management involves weight loss for overweight individuals and avoidance of certain foods. Patients should also not eat before they go to bed. Patients can be put on a higher dose along with histamine antagonists, another drug that stops acid secretion if the initial dose of PPI isn't effective. Surgery is reserved mainly for people who have good response to PPIs but do not wish to take it to the long term due to adverse effects. This is because people who do not respond to PPIs do not respond well to surgery, with a post-surgical complication rate of 20%. Complications of GORD include esophageal ulcers, hemorrhage or perforation, esophageal stricture due to the collagen deposition while the esophagus is trying to heal from the damage that acid has caused, Barrett's esophagus, which is when there is metaplasia of the cells in the esophagus, or an edema carcinoma. Thank you for watching our video and please ask any questions below. Bye bye.